Hi, I'm Congresswoman Terri Sewell, and I'd like to welcome you to a very special edition of Terri Talks. Today, we're here to talk about an issue that is critical for the communities that I represent in Alabama's 7th Congressional District, our rural health care. We know that our rural hospitals and health centers are already facing unprecedented challenges here in Alabama. But sadly, politicians in Washington are working to make the situation even worse. In July, President Trump and congressional Republicans passed the largest cut to health care in United States history in order to give a tax break to the wealthy. President Trump's so-called Big Beautiful Bill, which passed on a pure party line vote, makes nearly $1 trillion worth of cuts to Medicaid. We know that Medicaid is a lifeline for so many of the people in Alabama, especially our children, our seniors, and the disabled. More than half of all births in Alabama are covered by Medicaid. More than 68% of our nursing home patients rely on Medicaid. And more than 20% of Medicare beneficiaries rely on Medicaid. The list goes on and on. Medicaid is truly a very important provision in our healthcare, and it's so critically important to so many Alabamians. But Medicaid isn't just important to individuals, it's also a lifeline for our rural hospitals, many of which are already struggling to keep their doors open. In 2023 alone, Alabama hospitals received $3 billion in Medicaid payments. Because state officials have refused to expand Medicaid, Alabama already has a bare bone minimum Medicaid program, one that has accelerated the closure of rural hospitals throughout our state. To make matters worse, President Trump and Republicans are currently taking away critical tax credits that make healthcare affordable for 22 million Americans, including 53,000 Alabamians in our district alone. If Republicans let the tax credits expire, healthcare costs will skyrocket, not by a few dollars, but by hundreds, even thousands of dollars. In fact, it is estimated that the average American enrolled in the marketplace receiving their health insurance from the Affordable Care Act will see their premiums double. For the average family of four in our district earning $64,000, annual premiums will rise by $2,571. That's a 344% increase. At a time when Americans are already dealing with rising costs, letting these tax credits expire would only push healthcare further out of reach for so many Alabama families. When families lose healthcare coverage, our rural hospitals and our health centers suffer. Because when people can't afford insurance, they delay their care until it becomes an emergency. And then they show up in the emergency room unable to pay. That means that more uncompensated care, more financial strain, and more hospital closures. We've already seen what happens when our hospitals can't make ends meet. Alabama has lost too many rural hospitals in the last decade, forcing residents to drive hours for basic care. These healthcare cuts will push even more hospitals to the brink. Our hospitals will be forced to choose between eliminating essential services or even closing their doors. We simply cannot let this happen. Now more than ever, we need to speak up and speak out and make sure that our voices are being heard, that Alabama hospital systems, Alabama critical care centers, Alabama health centers cannot afford any further cuts. I am thrilled today to be joined by Keshee Dozier-Smith, the CEO of the Rural Health Medical Program, Inc., located throughout the Black Belt. Keshee, thank you so much. You and your team have worked hard every day to provide quality, life-saving care to our rural communities. You are on the front lines of the fight to save our rural hospitals and healthcare providers, and I want to thank you for your extraordinary efforts. To begin with, why don't you tell us a little bit about the health center and what you all do? How long have you all been open and what kinds of services that you provide?
Absolutely. Thank you so much, Congresswoman Sewell, for having me today. As mentioned, my name is Keshee Dozier-Smith, and I serve as the Chief Executive Officer of the Rural Health Medical Program, located in Selma, Alabama. We serve over 6 counties in West Alabama, one being Dallas, Perry, Marengo, Clark, Monroe, and also Wilcox County. Our health centers have been around for over 4 decades, being pillars in the community when it comes to primary and specialty healthcare services. With the funding that we do receive from Health and Human Services, also from Medicaid and other payers, allow us to not only take care of our patients and keep our health centers thriving and providing services in the community, but we also serve as economic sources because we hire locally. We put our money back into the community when we partner and collaborate with other local businesses. So any type of funding delays or shortages impacts not only the work that we do for our patients, the job opportunities that we provide for those in the community, and also the partnerships and funds that we put back in our communities.
So, what kind of challenges do you think that rural community health centers face that are maybe different from urban areas? And has that challenge been exacerbated by the fact that Alabama didn't expand Medicaid?
Well, absolutely. With the lack of expansion, what we saw was a lower reimbursement rate. So we're providing the same services of health centers in urban or metropolitan areas, but not receiving the reimbursements for those services, which means we're basically seeing patients for pennies on a dollar.
Yeah.
Just to be honest with you, we're also currently going through the process of getting a reimbursement rate, and we haven't had one as an organization in over 19 years. So that
Gosh.
process has been definitely an uphill battle, just trying to get a rate correction to go with the cost of seeing a patient today. Um, with the lack of expansion, what we've seen were gaps in care for individuals that should qualify for the benefit, and it has also created barriers for those that do qualify to keep and maintain their healthcare insurance to be serviced.
Right. So we know that in this new tax bill that passed recently, there is a huge cut, almost $1 trillion worth of cuts to Medicaid. And we foresee that over the next 10 years that millions of Americans are expected to lose their health insurance. How does your facility, how does the community health centers that you run deal with folks who don't have insurance? And what will any increase in uninsured patients mean for your health center?
That's a great question. So, how that will directly impact us with those cuts? Our operations, accessibility to patients, hours of operations, how frequently a health center. We have 9, by the way, across
Yeah.
6 counties, and we have a mobile unit that's actively going across those counties to fill in the gaps. So that means a reduction in hours, a potential reduction in staff, recruiting for the staff members we need to improve workforce currently comes to a halt. Any expansion in specialty care for our chronically ill patients in these rural communities that are unable to get to urban areas, it all gets placed on the back burner because we're trying to provide just the primary services. It's a very unfortunate situation to be in as a leader in a rural community. But as you know, Congresswoman Sewell, in these rural areas, we do a lot with a little. Um,
Absolutely.
and we make it look very easy and we do it with grace, right? But the truth of the matter is you have staff that's burnt out. You have staff that they're faced with the inflation of just the cost of living. So not being able to get a raise or get a bonus, they're starting not to feel appreciated to do the work that needs to be done and the work that they're passionate about.
Right.
So trying to maintain balance in staff appreciation and valuing them as assets and what we do versus being able to keep the lights on or ordering the supplies needed to provide the services. There are different challenges that we're faced with every day. So with those cuts, we're placed in an even more critical time in business to provide these services to the people that need it the most.
Yeah, and I just wanted to just reiterate that that the community health centers that you run are the lifeline of the 6 counties in the Black Belt that you serve. It's a real lifeline and has been a lifeline for, as you said, decades. And so yes, you are used to doing a lot with a little, but I would assume that if Medicaid is cut, if we find out that those people who are being serviced by the Affordable Care Act, that that's their insurance, if they're no longer able to afford that, that would be an additional burden on an already burdened system. And I really want to just start by thanking you for all that you and your staff do each and every day as the lifeline for so many of the constituents that I represent in rural Alabama. And I really wanted you to talk a little bit about what happens when you have uncompensated care. How does that affect your bottom line and your ability to operate?
Right. So you start having those hard conversations with your board members and your staff. You identify the health centers that you own and those that you don't. And you start making hard decisions and 30, 60-day, 90-day plans in the event of the cuts actually happening or the payer rates not being increased, right? So for every patient that does not have insurance, it's a reduction in the reimbursement of service that we provide. So and how we determine those rates, we take the Medicaid bare bone minimum
Yeah.
reimbursement
Because
rate.
we know that in Alabama, we literally have a bare bone Medicaid. I think people don't understand just how, little you have to make in order to be on Medicaid in Alabama. I mean, you have to be not just poor, but P-O. Like you have to
Right,
make
right.
absolutely no money in order to qualify to
Absolutely.
be in Medicaid. So you're already struggling, and then to have even more reduction and cuts in Medicaid. I mean, it's just it's untenable in so many ways.
And it puts strains on other relationships you may have. So, as a community health center leader, it's very important for me to have relationships with other specialists in the
Yeah,
communities because we refer our patients that require neurology or podiatry or vascular services to other specialists. And if they need to go for imaging with the hospitals who are also impacted by these services,
oh yeah,
puts them in a chokehold as well. If a patient that's uninsured does not come and or not able to come to a community health center or a health department or primary care provider, they're going to the emergency rooms, as you stated in your opening statement, and that's putting a drain on the hospital resources because if that bill is $10,000 and $15,000 every time that chronically ill patient comes in and there's no reimbursement, then that's a deficit in that hospital's bottom line each month. And there's several of those in rural communities. And that's why we've seen over the past 3 years, several of these rural hospitals closing. So it's very important for organizations such as Rural Health Medical Program to work with the Brian Whitfields, the Bond Regional Medical Centers, and the other hospitals in my counties to make sure that we're doing our part and we're playing that role as a pillar in primary health care and dentistry and podiatry, optometry, things of those services that we do
yeah,
provide so that we can prevent patients from immediately going to the emergency room for things that are not urgent matters, but
yeah.
that are unmanaged primary care matters.
Right. And I think that what makes you all the lifeline is, as you said, you provide primary care for so many. And, it's better when they are insured. And I think that that's why so many of us support the Affordable Care Act is because for the first time I saw rural farmers who never had health insurance or folks in rural communities that are entrepreneurs who never really had health insurance for themselves and their employees. All of a sudden, they were able to get that, and the tax credits added as a subsidy. So that I saw many of the folks that I represent, being able to qualify for gold plans that were, say, $600, but they were affordable because the tax credit gave them half of it. Federal government paid for half, they paid for the other half. And so they got a $600 a month plan, but only had to pay 300. And so what we're talking about when I talk about the fact that we're going to the mat and asking our Republican colleagues in this administration to make sure that these subsidies do not expire. They are
Mhm.
critical to the ability of people to be able to pay. And I think that what folks don't realize is that come November 1st, we'll have an enrollment period for this coming year for 2026. And that enrollment period usually is 30 days. And all of a sudden, we're now faced with a rise in our premiums because Blue Cross Blue Shield and the other insurance companies understand that this administration is not keen on expanding or even renewing the current tax credits. So they factor that into the rates that they're going to charge for 2026. So we're going to see, and we've already, been notified that there's an increase in the premium rates. And so I think that unfortunately we have to brace ourselves for the fact that many people who are currently on the Affordable Care Act and have the health insurance will have to do the calculation of whether or not they can afford health insurance for 2026. And so our discussion today is critically important because I want folks to understand what's at stake and how it will impact not just their health insurance and their visits to the doctor, but how they will impact our healthcare providers across the board, and how community health centers offer that first line of defense, the preventive care, that primary care. And you're critically important, not just for that, but for podiatry, for dentistry, I mean, the services that you provide are basic, really, important services that will be impacted when the cost to care for people go up.
Right.
Yeah. And so, can we also talk about the fact that you're not just providing health care? As you said, you are also a major economic driver in the communities that you provide healthcare services for. You employ people. You have a staff. You also, people want to reside and work in communities that have good community health centers and good hospitals. And so the fact of the matter is that it's all integral, it's interrelated. Related. It's
Mm-hmm.
not as if you can have one without the other. You need healthy rural hospitals to be able to send your patients to, and they need primary doctors and primary care so that the people are not just coming for emergencies. So can you talk to us about the economic impact that your facility has in Dallas County, Marengo County, in the counties in which you have health
Absolutely.
facilities?
So total, we employ upward of 70 employees. And so those employees,
70, 70.
7-0
Yeah.
across 9 locations and 1 mobile unit. We service upward of 10,000 patients a year.
Yeah.
So when we back that out, that means that 70 families, well, at least 10 to 12 individuals per city or per county that we're working in live and contribute to the local taxes that are going back into that
Yes.
community.
Yeah.
They're shopping locally, they own a home, their children are in school. So it's helping with the school funding, the tails and the seats there, the school systems are still getting their funding. We have partnerships with them as well. Again, they're shopping there. So the local sales tax and keeping those local grocery stores and gas stations open. Our patients, like I said, we see upward of 10,000 patients. So for every patient we see, if they're on medication, they're going to a local pharmacist. So that's
Yes.
keeping the CVS, that's keeping the Walgreens, that's
And
keeping
those
the
independent community pharmacists.
right. And then, yeah, we do. We have several local mom and pop
Yeah.
pharmacists that have their drugstores there. And so when you don't have your patients, not that we want patients sick at all, but if they're on maintenance medications to improve their overall health, having a healthcare provider know that, hey, they need to be on this type of medication to improve their health outcome for whatever the period, that keeps that local business employed, right?
Hmm.
If they're funding in the community for transportation services, for adult daycare, things of that nature, our health center serves as a hub to feed those type of programs
Yeah.
and request that funding. So we, like you said, we're all interlocked and working together to improve the overall health of every community that we serve, and also make sure from a tax perspective, and also just from businesses continuing to stay and remain in those communities.
Yes, that's the indirect, right? When you
Mhm.
think about the fact that that healthcare and having access to affordable health care in one's community is an economic driver. It helps you get economic development. It helps people want to come to those communities to work and live. And so those are all indirect. These are not even people that you necessarily serve, but they're
Mhm.
coming because there is access to good quality health care in those communities. And so, for me, I think that people don't really connect the dots. They think that, well, I got my health insurance, so why would I care that the Affordable Care Act, those who get their health care from the Affordable Care Act, why do I care that they may not have health insurance? And I think it goes back to something you and I both talk about. Uncompensated care is spread out among all of us, so that when people who don't have health insurance and can't afford to pay for their own health insurance, they wait until there is an emergency or an end of life, event that is just so catastrophic. And all of us, that those are spread among all of us, which is why we should all care about that. Can you talk to us a little bit about the fact that we have not seen that right now we're in a government shutdown and we have not had a budget in 2025. We are still living under the 2024 budget. So you have not seen an increase, even though we are all experiencing inflationary times. We know that the price of gas has gone up. We know that the price of groceries has gone up. We know that the cost of the supplies that you need in order to keep your facilities running have gone up. And yet you're still operating on a flatline budget of 2024. Is that not right?
You're correct. And I will tell the major impact, like I just stated a few minutes ago, is you have so retention has been the biggest thing and recruitment of your staff.
Yes,
So
yes.
when I'm competing with the hospital who's also competing with just getting a qualified RN or a DNP or an MD, so it's like you have to have these partnerships with the hospitals or urgent cares or other organizations to say, hey, how are we going to collaborate with this particular asset? um, and it sometimes it works, sometimes it doesn't.
Yeah,
So when a doctor can come to you and name their price, where you're paying a doctor, let's say 235 to 240, now demanding 280, we're not that kind of facility. And
yeah,
we I desire to be, because if that's the rate, if that's the cost, that's what I want to be able to pay. But if Medicaid isn't expanding, if the reimbursements for Medicaid, Medicare, Blue Cross, Aetna are not increasing for us to be able to provide that type of salary, not even just to a provider, but an RN, right?
yeah, 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 yeah.
Masters that would desire to make 60 and $70,000, because that's what it costs to live in these rural areas.
Yeah.
You want to be able to not, miss the opportunity of locking down that resource. Or for those that have been here for years, like watching your LPNs go from starting their career with you, going to get their RN, then becoming a nurse practitioner and being able to pay more than the hospital. That was my bragging right a few years ago.
Yeah,
But
yeah,
now it's more so you're in line. So it's, do I want to work 3 days or do I want to work 5 days and a Saturday? Right.
yeah.
And the other impact, like you said, we've been seeing our vendors, who I don't call them vendors because we have to be family at this point, because
Oh,
we
yeah,
have to negotiate these bare bone prices to say,
yeah,
hey, for that same box of gloves that we were buying for, $12.88, you want $22 for now. Like, come on,
yeah,
we're federally funded. That's the first
yeah,
thing I say, right? We are taking care of the underserved, so it's having a lot more critical and hard conversations with those types of organizations, and some of them get it and some of them don't. They're like, hey, we're feeling the heat too. So it's finding the right vendors that get what you're doing, and they have the heart of service and compassion for what you do. There are organizations out there that are fair price,
yeah,
and you're able
yeah,
to get the resources you need to take care of your patients and keep your operations going. And there are
yeah,
also other organizations, if you had to outsource services like IT or things of that nature, where they're local, they're entrepreneurs, they get it too, so they work with you. So we've been very fortunate for that. But as you stated, we do feel that we've increased our payer mix. We used to be a 70-30 split, where we were 70 insured, 30 uninsured. And now we're more at 50-50 right now. And the reality of it is every time an individual transitions from being insured to uninsured, we we're not going to turn our backs and close our doors on our community. That
Right.
we don't turn our patients away because we're here for them. And that's what we pride ourselves on as a community health center. And so when individuals are going through transition, the goal is to, when you are going through the transition, we want to also retain you when you have gotten that
Yes.
new job and you
Yes.
have insurance
Yeah.
as well.
Yeah.
And
Yeah.
that's one thing that is not talked about a lot. A lot of people see community health centers, specifically rural health medical program. When I got here almost
Yes.
10 years ago, people thought that's where the poor people go. No, this is where most of the people in the community go. In some of these areas, we're it. And so I made it a point to where the facility looks, they look like, the state of the art or nice
Yes.
urban type
Yes.
facilities. I made sure that the uniforms, when they walk in, they were in logoed scrubs. I made sure that the technology was up to date, the
Yep.
signage was up to
Yep.
date. If it was down to out there planting flowers, as CEO, I'm gonna go plant. I do that.
Yeah.
I
I
do
know.
that too. You don't have the luxury of having an interior designer. You
Mhm.
just get it done. You know what I'm
Right.
saying? So when you have that payer mix continuing to grow because of the economy, the lack of jobs, or the shortage of available resources to create those types of opportunities in the community, you have to be creative. So we're
Right.
constantly writing grants, right? We're constantly looking at how do we bring more of the quality dollars in from the insurance program. So things like chronic care management, remote patient monitoring, we're 340B eligible. So those types of
Yes.
programmings help supplement the insurance reimbursements that we're lacking and not seeing more of because that increase in uninsured patients have occurred. So the administrators, the billing team, the
Yeah.
grant writers, the care
Yeah.
coordinators are working just as hard at Rural Health Medical Program as the nurses and providers. And it gives us a sense of appreciation and pride to be able to work alongside the side with each other to make sure that everyone's bringing something to the table and covering their cost.
And we are just so appreciative the rural health medical program is located in that this is a federally, as you said, it's federally funded. I wanted to ask you whether or not have you seen, are you still getting regular payments from HRSA and from the federal government the way that you need in order to make your payroll, in order to be able to provide and pay for your vendors? Because I also know that there was a lag at some point. I mean, I hope things have
Right.
smoothed out, but I want folks to understand that, you know, you're keeping your doors open in so many communities is a miracle. And on
Yeah.
top of that, to see the burden of not getting an inflationary increase in the amount of money that you're receiving, not getting, in some instances, especially with this Affordable Care Act, if people don't have the subsidy, the people who you currently serve who are insured, many of whom will now become uninsured. To go to
Right.
your pay mix, your mix goes from 50-50 to now all of a sudden a more, it's more burdened
Amount.
on the
Yeah.
uninsured
Hmm.
in terms of that. And so, I also want my constituents to understand that I'm fighting for not I'm not asking for much. I'm just asking for a budget to be bipartisanly negotiated, that
Hmm.
we don't have another continuing resolution. We have a budget that fully funds our federal government. And also at the same time takes care of the health care that so many of us need. And that to me is not an either or, it's an and. And
Hmm.
I know that this shutdown is a hardship for so many. But I also know, just to be very, very clear, what I'm fighting for is a bipartisan budget that
Hmm.
fully funds government, that reopens government, and that takes care of the health care needs of the American people. And that rising costs is not going to go down, it goes
Yeah.
up. And that means that we need a budget that fully funds that. And so, I know times are rough, but this opportunity and this Terri talk to you about healthcare also gives me an opportunity to talk about what it is I'm fighting for and why it's important. And I want to thank you and the other community health centers that come up to Washington year after year, and
Hmm.
and you're seeking not a big increase, but a slight increase. And the
Yeah.
fact that we have not had a budget really does make a difference. We cannot continue to fund on 2024, at a 2024 level when the expenses are a 2025, 2026 expense. And so that's critically important. So I just want to thank you for being a part of the Terri Talk today. And I want to thank you for being in our communities and being such a pillar in our community, providing that primary care and taking care of chronic diseases that so many of us have, whether that's
Right.
diabetes or hypertension. There are a lot of chronic illnesses that just need to be managed day in and day out that
Right.
your center actually does for us. So, in closing, if you had a message to give to those elected officials that are determining, you know, the budget, that are determining whether or not we have, tax subsidies that will help people be able to afford the health insurance on the Affordable Care Act. Just any words that you have for those of us who are literally fighting the good fight every day, but know how hard it is to make ends meet, and are so appreciative of the work that people like you do.
Yes. My message would be very simple: protect and invest in rural communities. Every policy decision made at the federal level affects families in rural Alabama. We are depending on you to make the right decisions for our communities and your families. And Congresswoman Sewell, I would just like to take the time to thank you so much for your leadership and for giving me a voice to represent a community that you grew up and you're from as well. We appreciate all the work that you do that continues to transform our communities into thriving areas, regardless of the size, and continuing to make great people to stand up and continue to lead just as you. Thank you so much.
Well, thank you. I really do, from the depths of my heart. Your nine facilities and your mobile unit are truly, truly the only healthcare in many of the communities that I represent. And so, your success is our success as a community, as a district, and we'll continue to fight together to
Yes.
make sure that we are investing in rural Alabama and in the healthcare and the healthcare services for all Alabamians. So thank you again for participating in today's Terri Talk. And to my constituents, stay tuned for the next Terri Talk, and know that your Congresswoman is fighting for you each and every day. And that is especially around healthcare, knowing the challenges that we face. So again, thank you so much, and be nice to your community health center professionals
Yes.
when you see them, because
Thank
they're
you.
fighting for you each and every day. Thanks, Keshee.
Thanks.